I presented yesterday the results of the AHL 2011 study, which was dedicated to evaluate a PET-driven strategy in patients with advanced Hodgkin lymphoma. And this study showed that a PET-driven strategy after 2 escalated BCOP delivering 4 cycles of ABVD for negative PET2 patients and 4 cycles of escalated BCOP after the 2 first escalated BCOP in PET2 positive patients provide similar progression-free survival and overall survival that standard treatment, not PET monitored, and with a 6 cycle for escalated BCOP. So the results are quite impressive because we have 5 years progression-free survival of higher than 85% in both arms, and overall survival higher than 95% at 5 years. The study shows also that a second interim PET performed after 4 cycles of treatment, either in the standard in the experimental arm, provide additional prognosis value to interim PET2. And the full assessment of interim PET allows to identify 3 subsets of patients, with 86% of patients with double negative interim PET have a quite good outcome, with 5-year progression-free survival higher than 90%. The patients with positive PET4, 6% of patients had quite poor progression-free survival, 5 years, 46% progression-free survival. And there is an interim group, so responding patients with positive PET2, negative PET4, with intermediate prognosis, with a 5-year progression-free survival of 75%. And this full assessment of interim PET translate also in overall survival difference, and the population of patients with double interim PET have a better overall survival than the 2 other groups. So this study established probably a new standard of treatment if we have the choice to start with escalated BCOP, and this study supports the de-escalated strategy with 4 ABVD for negative PET2 patients.